All right, welcome. My name is Basil Acey. I'm with the VCU Paramedic Program. This is my first broadcast, and today we are going to be talking about our body's response to shock, and more specifically, the neuroendocrine system and how it responds to shock. Um, what I hope to illustrate is how the big picture of how our body is able to respond to shock, and not only how our treatments are geared or tailored to being able to uh, treat shock in such a way. I'm going to present this with a Prezi presentation, so I will share that with you, the screen share right now. If you have any questions, you're more than welcome to send me an email. My email address again is B as in boy, AS as in Sam, AY. That's BASAY at vcu.edu. And you're welcome to send me a question via that email. Let's see here. And share this screen with you. All right, so let's take a look at the big picture here. The big picture is our body responds to shock via 4 different activations. Very well. The sympathetic nervous system is activated, as well as some acute phase proteins. Those are activated, and our endocrine system is activated. That involves, our adrenal glands, our pituitary glands. Those are activated in response to injury. Also, there's another system many of us have already heard of called the renin-angiotensin aldosterone system activation. That also is activated in this whole big picture look at our neuroendocrine response to that whole idea of shock. Right now, let's look at our sympathetic nervous system. All right. So the sympathetic nervous system we know is activated, and it kind of is what kind of brings that fight or flight response in our body. Okay. When the bear is chasing us through the woods, we need a certain amount of response to be able to get away from that bear. Or take, for example, many of you can relate to this. I hope not in a bad way, but when you are driving and you have a police officer pull up just behind you, think about how your heart begins to start racing, how your hairs stick up on the back of your head a little bit, and how you just seem to be more alert and more aware of everything. That's that sympathetic nervous system response. There is some receptors in our body that are located in the aorta and carotid areas. These are baroreceptors. These baroreceptors help to trigger the sympathetic nervous response by lack of volume or lack of stretch, so to speak. So the baroreceptors are very important in sensing the amount of volume or stretch on the actual vessels of the aorta and the carotid arteries. There is also some chemoreceptors in that area, and those chemoreceptors cause you to increase your heart rate, and they work in relationship to also sensing that there is a decrease in oxygen as well. So when the body receives the signal from these chemoreceptors, hey, I don't have enough oxygen in my bloodstream, or my O2 partial pressure is low, well, therefore I must do one thing or 2 things here, and that's increase my respiratory rate and also send a signal to my heart that maybe I need to move a little bit more blood a little more quickly. So that is all works in concert here. So those receptors can be found in the aorta and carotid areas. They send those impulses to the adrenal medulla, which is then stimulated, and the adrenal medulla is very effective at putting off 2 catecholamines, one being norepi, the other being epinephrine. Epinephrine, I give it a B+ here, because epinephrine does what? Epinephrine Yeah, that's right. Epinephrine activates or is an agonist for the beta receptors that are found in the body. So just as a review, what do the beta receptors do in the body? So when a beta receptor is activated, what is happening in the body? Okay, so the beta receptor activation increases heart rate. It, let's look here, causes systemic vasoconstriction. All right. It also has some of those receptors are also in the lungs as well, right? So versus in the body, we see vasoconstriction. What do we see in the lungs? And I hope you all are answering me with these. We would see in the lungs that vasodilation, right? So because we want to get that whole fight or flight response really is to get moving. So we need to get some oxygen into our lungs very quickly. So let's just open up those bronchioles and open up those areas so that we can get that air down in there, and we can get that oxygen to our vital organs very quickly and much more rapidly. So that is the beta response. It, again, increases heart rate because there's a lot of beta receptors in the heart, and it increases that force and the contractility of the heart, so it can pump more effectively. There's another common pathway as far as the sympathetic nervous system goes. That pathway originates in the vasomotor center in the medulla in the brain, and it sends these signals through these sympathetic nerve fibers, and they signal to give off norepi as well to a much greater degree. And I give norepi a big A+, because norepi, that's right, is an alpha adrenergic receptor agonist. And what that does is it is very effective at increasing arterial pressure, because why? Where can we find those alpha receptors? Yes, alpha receptors are very much located in that whole systemic vascular circulation area, the blood vessels. Okay, so we are having the objective here to increase our tissue perfusion centrally. So as we see those alpha receptors activated, we see increased arterial pressure because the blood is then being shunted away from the periphery, okay? Because those little vessels out there are just constricting down. They've been activated. Those alpha receptors have been activated by the norepi, and we see that shunting of the blood coming to the core of the body, increasing that central tissue perfusion, and hopefully our objective here is to increase our overall cardiac output. There are some other changes that occurred, some metabolic changes as part of the sympathetic nervous response. We see an increase in glucose, free fatty acids, as well as some amino acids, and that is kind of the overall big picture here as far as that sympathetic nervous response. This is just a very brief and very quick review. Another response here that we talk about is how our kidneys are activated in response to not having enough perfusion to them. And what they do is they send off this, they realize, hey, I don't got enough perfusion, and they start sending off this chemical called renin, all right? And that renin binds with another protein called angiotensinogen. And together, they come together and create a completely new protein called angiotensin 1. All right, so angiotensin 1 is kind of like their byproduct, or their little love child here. So angiotensin 1, is very effective at, I apologize, let me back up here. Angiotensin 1 will then travel in the bloodstream, and then in the lungs, there is something called what? An enzyme that also will help to change that angiotensin 1. Yeah, it's that angiotensin converting enzyme. And that angiotensin converting enzyme cleaves yet another protein off of, or another segment off of that protein of angiotensin 1 and creates a completely new protein called angiotensin 2. Angiotensin 2 serves a number of functions in the body. One of those is it acts on the adrenal cortex, and it causes aldosterone to be released. Aldosterone is very effective at telling the kidneys conserve water. Anytime the kidneys conserve water, they also conserve sodium. So if it is causing this to happen, these chemical reactions cause the body to then excrete potassium and hydrogen ions. So the objective here being that as aldosterone releases, we increase our overall fluid volume simply by conserving water. Angiotensin 2 is also a very potent vasoconstrictor as well, and it increases the intravascular volume. So I apologize. Angiotensin 2 causes marked arteriolar constriction and moderate venous constriction, which ultimately results in, yes, systemic vascular resistance being increased, and this results in increased systemic blood pressure. Overall, this is kind of that very brief overview of that renin-angiotensin system. Our objective being increase vascular resistance and increase vascular volume. And that protein, so to speak, that does it, that activates that is that angiotensin 2. The other response to insult and injury, the other neuroendocrine response here is the endocrine activation. This happens and occurs in response to a body recognizing a decrease in arterial pressure, and it sends a signal to the posterior pituitary to release something called antidiuretic hormone, and that and also another hormone, one that we probably have not heard of. This comes from the anterior pituitary, called ACTH. ACTH stands for the adrenocorticotropic hormone. And this hormone is very effective at a couple different things, okay? Obviously, being that it stimulates the adrenal cortex to secrete cortisol and aldosterone. Basically, what we would expect anytime cortisol is excreted is an increase in blood sugar, I apologize. When blood sugar is increased, you know, what is one problem with that? Sure, if blood pressure gets too high, then it causes a little bit of a diuretic effect. So we don't want it to get to the point where it increases to the point where the patient becomes, starts having to diurese. However, what do all cells need in order to live? They all need oxygen and glucose, right? So the body, in response to this insult and injury, is going to say, we need more blood sugar. Let's get more sugar to it. So this is kind of the way it goes about doing that. The other thing is it acts on the kidneys also because it releases aldosterone. And we learned from just a minute ago, aldosterone acts on the kidneys to conserve water and sodium. Okay, wherever water goes, so does the sodium, or vice versa. Then again, we come back to, you know, body senses that decrease in arterial pressure. The posterior pituitary releases this antidiuretic hormone, which incidentally is also called vasopressin. We have it in our drug boxes. Vasopressin, as you know, if any of you have ever used it, is a very potent vasoconstrictor. So it causes significant increases in systemic vascular resistance. It also causes the distal renal tubules in the kidneys to reabsorb H2O, okay? Ultimately, our goal-oriented objective here is to increase venous return and cardiac output, to bring everything in and shunt it to the core kind of thing so that we can conserve what we have left, bring it into the important organs that are currently at this point being threatened. The other thing I won't talk too much about is those acute phase protein activations. Basically, this happens anytime in response to injury. That injury could be traumatic, such as a burn, or even medical, such as a myocardial infarction. Could even be sepsis or any inflammatory disorder. The liver has these special cells called hepatocytes. Hepatocytes basically create all these different proteins in the blood. One of the biggest proteins that we have in our bloodstream is something called albumin. Albumin is very important at that whole oncotic pressure, keeping the blood inside of our vascular system. So albumin is very important. You see those people who are in renal failure, and they have those great big bellies. What they're suffering from at that point is this third spacing of fluid that's being shunted or moved out into their abdomen because of the lack of the ability for the liver to make enough of this albumin. So because of the loss of that oncotic pressure, or that pressure holding the fluid inside the blood vessels, the fluid, so to speak, is then being moved. Everything except for like plasma and stuff and water is being through the process of osmosis coming out into the third space areas of the body. That could be the feet, and you see that when you have pedal edema, or it could be ascites in the stomach and such. When the body recognizes that there is a decrease in albumin, and serum proteins are then trying to be increased, we're going to see a whole bunch of things start happening. Our body is going to say, oh my goodness, something's happening, and we need to send these mediators to go fix that problem right now. So the liver and these hepatocytes are going to start creating all these different proteins. They're going to create C-reactive proteins, complement proteins. I highlighted there fibrinogen because that's going to be very important in helping us stop bleeding. Okay, fibrinogen is kind of that protein that makes that meshwork to create the clot. Okay, there's other proteins and other clotting factors that are involved here. All of these clotting factors and proteins all work to increase one thing, and that's your erythrocyte sedimentation rate. I'm not going to spend too much time on that, but I just wanted to point that out. This is a lab that they draw sometimes to measure the amount of inflammation in the body, because anytime the body is suffering from insult or injury, we have our reaction to it, our body's reaction to it is to respond with some type of inflammation. And that means that all these proteins are being kicked off. Some of these proteins do one thing, some proteins do another, and it really, that is kind of a lecture in and of itself. But ultimately, there's a test that they do to measure the amount of proteins that are in the whole blood, and they do that by testing how long the erythrocytes, those red blood cells, take to fall to the bottom of, say, a test tube, and they time that. That's called your erythrocyte sedimentation rate. And the more proteins that are in the whole blood, the slower those erythrocytes are going to fall and separate, therefore increasing your ESR. So that's just a fun fact. And this all, like I said, the whole point of all these proteins and everything is that they're going to migrate to the site of injury. Hopefully, they are going to have the correct proteins to help mitigate the problem, whether it be sepsis, whether it be disease, whether it be trauma, okay, in the sense of clotting factors being needed. They're going to migrate to that site of that injury. And ultimately, they're going to be there to regulate, coagulation, the metabolism of that as far as what our body needs at that time, and, as well as they're going to provide that, they're going to cause that inflammation. Again, especially in the sense of trauma and hemorrhage and stuff like that, you're going to see the objective being here to conserve intravascular volume. All right, so that's kind of, just very briefly, that's that whole acute phase protein activation process. I hope this was, this again being my very first broadcast, it's kind of choppy, I know. I need a little bit more practice with this, but I hope this was helpful. And if you have any questions, don't hesitate to call me and ask me. So.